All right, let's talk about infections. How do these infections induce cancer? And then we'll talk about some environmental factors. So viruses themselves can integrate into the host genome. So for example, like hepatitis B and C, patients are at a higher disposition for developing liver cancer. HPV, these patients that are exposed to human papillomavirus, HPV, they're at higher levels of developing cervical cancer, and now there's actually vaccines for young girls to prevent risk of cervical cancer later in life. HIV patients, this is the Kaposi sarcoma that's listed here. This is a tumor that's caused by the human herpes virus 8. And it's a systemic disease, this Kaposi sarcoma, that's present with skin lesions, cutaneous lesions. And it's widely was publicized in the 80s as being the AIDS-defining illness, was this skin Kaposi sarcoma. Okay. These patients are also at risk of developing non-Hodgkin lymphoma. That's a cancer of the lymph tissues and the connective tissues. And the last one on this particular slide is bacteria. So you can see this schematic on your right that's showing the H. pylori bacteria and how it can trigger an infection in the stomach or the duodenum and increase the chance of developing stomach or duodenal cancer. So the infection, this is what the helicobacteria looks like at high magnification. A lot of times it will preferentially collect in the antrum of the stomach or the distal portion of the stomach before it empties into the duodenum. At higher magnification, these H. pylori kind of infect the gastric mucosa, cause an inflammatory signal to ensue, and this can lead to ulcerations in the tissue where there's holes and lesions that are punctured through, and this chronic inflammatory state, whether it's this or ulceration, leads to long-term risk of developing stomach cancer. Question?
Quick question. Do we see, since HIV and AIDS is so it's reduced so much because of vaccines, do we see the Kaposi sarcoma?
We don't.
Anymore?
We don't see Kaposi that often. Back in the 80s, it was a lot more prevalent. A lot of these patients are in the clinical latency period with HIV for a longer period of time before AIDS develops. More and more of these patients that do have AIDS are less symptomatic, or do have HIV are less symptomatic for a longer period of time, and then when they develop AIDS, their symptoms are better controlled. So you don't necessarily see it nearly as prevalent. Good question. Okay, environmental factors. This stuff happens every day, right? Ionizing radiation, UV radiation, maybe not asbestos as much anymore in this country, air pollution, electromagnetic fields, question mark on cell phones. That's still an area that I don't think we'll really understand what the risk factors are. Surrounding cell phone use. Are there electromagnetic fields that are created when you use a cell phone? Yeah, they're very small. And that's kind of what we're all banking on. But we'll talk about this in respiratory, but there was a point in this class when, I've been teaching this class long enough that I remember when the vaping came on the scene. Or it was originally called the e-cigarette, the electronic cigarette, now it's vaping. Really all the same concept. And so I've been teaching this class for a while, and then we started seeing the vaping or e-cigarettes. And we'll talk about it more, but questions that were coming from the class were, what do you think? Do you think it's safe? Do you think it's not safe? And so now some of you are smirking like, wow, if I could have told those students what we know now. But I have those recorded lectures. And so I look like I have a crystal ball, because basically what I've said is, we weren't really designed to be inhaling air that you can actually see. Like, it wasn't designed for that. We can actually pull contaminants out of the air pretty well, but we're probably overloading the system. And there was a time, I'm old enough to remember, there was a time where tobacco companies promised that cigarette smoking was not hazardous to your health. Okay, back in the 70s and 80s, it wasn't a problem. You could go to a restaurant and people would be smoking right next to you, whether you were smoking or not. So this is a picture of a macrophage consuming asbestos. Consuming asbestos. So we've seen macrophages before, and so there's an asbestos particle here. The macrophage has actually gobbled it up and is trying to get rid of it. Okay, so let's talk about where some of these things transect. Okay, so for example, if you have multiple risk factors happening in the patient, we're going to look at just smoking and alcohol consumption. So there's over 30 different carcinogens in tobacco smoke, and 30% of all cancer deaths are contributed are tied to cigarette smoke worldwide. Okay, in this country it's a lot lower than it is outside of the United States, and there's many types of cancers. And so you can create a graph like this for a lot of different types of carcinogenic agents. Like you could go with smoking and air pollution. You could go with air pollution and radiation. Okay? But the point I'm trying to make is look at relative risk. Okay? So we've got alcohol consumption, which is a risk for developing inflammation. And we'll talk about that when we get into liver. Okay? And so alcohol consumption, this is grams per day, so it doesn't want to, you can calculate this out on how much you drink. I didn't want to really make anybody feel really bad right away, so you got to go home and calculate this. What's 120 plus grams a day, Keller? Is that like 2 beers or is that like 12, you know? So you can calculate that out. And then you've got the different color bars of tobacco smoking and cigarettes per day, okay? Probably fewer smokers in this classroom than in outside the United States classrooms. But you can kind of see if you've got, as alcohol consumption goes up along with cigarette consumption, the relative risk exponentially grows. So the problem that we have with cancer is if you're in an environment where you've got multiple carcinogenic agents hitting the body all at the same time, you're asking your tumor suppressor genes to really do a lot. And there is definitely an exponential rate of risk as you add in numerous types of cancer-promoting opportunities. Does that make sense? So the bottom line is don't have a cigarette, get a sunburn, and drink alcohol all at the same time. All right, we're going to pause here. When we come back on, let's just answer this question, and then which of the following is not a typical characteristic of cancer cells? Which of the following is not a characteristic? Loss of cellular self-destruct mechanisms, unlimited replication, autocrine stimulation, or decreased responsiveness to growth signals? D, decreased responsiveness. They have an increase in responsiveness. Okay? Okay. We're going to pause here. We'll talk about treatments on Monday. Have a great weekend.